70 to 80% of people 65 and older have high blood pressure. Almost 80%.
Wow.
It's epidemic. If you don't know your numbers and bring them down, you're going to be a stat.
Hello, I'm Mary Colbert, and I want to welcome you to Dr. Colbert's Divine Health broadcast. I am so excited about this talk today, and I'm going to tell you why. This past month, Don and I were talking about things that came in about me, and it was so impactful to what happened to me. I said, Don, we've got to share this with the world. And this message, I'm telling you, is probably the most important message that you have ever heard. I want to encourage you, get a pad, get a pen. You're going to write this down. You're going to listen to this probably over and over again because we have some of the most powerful information. The name of this talk is Live Long and Live Strong. Now, how do you do that? There are some things you must know. And the things you must know is know your numbers. And you say, Mary, what do you mean know your numbers? You're about to find out right now. I'm sitting here with my husband, Dr. Don Colbert, and my son, Kyle.
Hey, Mom.
And we are so excited about this talk.
We are.
We just came from Marco Island preaching this message down in Marco
In
Island.
Naples, Florida.
In Naples, Florida. And I'm telling you, the people, the response was amazing.
And it went all over the world.
It went all over the world. So that's why we are motivated to bring this talk to you. You need to hear this. So Don, we're going to talk. You know, the Bible says that the life of the body is in the blood. And there is so much revelation to this.
Mary, I've been practicing medicine now for 40 years. And what I have found by practicing medicine for 40 years, that there are 12 key numbers that you need to know to live long and strong. And when you know these numbers and monitor them down to normal levels, these I've found are my healthiest patients that are generally disease resistant. Yes, they may get disease, but they're generally able to overcome it rapidly, and they rarely get these horrible chronic diseases like dementia, heart disease, diabetes, arthritis, or crippling arthritis, or autoimmune diseases. They're almost resistant to these diseases.
Now, we have been saying to you many, many years now, for years, my people are destroyed for lack of knowledge. Well, to be totally transparent.
Not for lack of faith or lack of love or lack of hope, but
lack of
knowledge.
Exactly. And so I want to be completely transparent with you. That's who I am. I am who I am. You know, take or love me, hate me, whatever. The thing is this: I've been lazy. I have been very preoccupied with a lot of things except me, taking care of me. And because of that, I've been very lax about getting my blood work done. And Don has been after me. He's been going, Mary,
For years.
you've got to get your blood work done. You've got to get your blood work. Well, I don't like getting my blood work because I've got little bitty veins and they usually have to stick me 3 and 4 times.
And Mary's like a turnip. It's hard to draw blood from a turnip.
Our nurse practitioner laxed me.
She finally got you.
Sure, she got me on the first stick. I was so excited, and the blood work came back. And Don came in and he goes, Mary, you're on fire. Your inflammation marker is off the chart. And I looked at him and I said, oh my God, I'm dying.
It opened your eyes.
It opened my eyes. My thyroid was in the tank. My testosterone was in the tank. I was on fire. My inflammation was through the roof.
And you had no energy?
I had no energy. Point made, guys. Listen, let me tell you something. I had a huge wake up. Why? Because I did what every one of you need to do. You need to follow up on this. I promise you, if you want to live long and strong, this is critical. I just want you to know my numbers are great now. I went to work immediately. I did a course correction. You know, we all need course correction from time to time. So sit back, enjoy this talk, get your pad and your pen.
There are 12 key things, numbers you need to know.
Yes. So Don, Let's go. Let's start with what number one number.
Well, the first number that everyone needs to know is their blood pressure. You see, 48% of Americans have high blood pressure. That's ridiculously high. But most people don't understand that in 2017, the definition of high blood pressure was changed. It used to be, high blood pressure used to be defined as anything blood pressure systolic greater than 140 and diastolic 90 or greater. So 140 or greater and is the top number systolic, and 90 or greater is the diastolic. But in 2017, it changed. And most doctors still don't know that. I'd say the majority of doctors, because patients that come in to see me with high blood pressure, their numbers are rarely controlled. In fact, only 21% of people with hypertension that are on medications have their blood pressure controlled. Only 21%. That's about 1 in 5.
That is unreal.
But the new numbers are anything greater than 130 systolic and 80 diastolic, greater than those, is high blood pressure.
Now, why did they do that? What's the reason
Because
for that?
so many people are developing cardiovascular disease. So they had to lower the normal range, or anything greater than 130 systolic is high blood pressure, anything greater than 80 diastolic. Now, 80 used to be considered normal,
Wow.
80 to 90. So
there-
now 48% of Americans have high blood pressure, but get this, 70 to 80% of people 65 and older have high blood pressure.
Wow.
Almost 80%.
Wow.
It's epidemic. If you don't know your numbers and bring them down, you're going to be a stat. And that increases the risk of cardiovascular disease, heart attacks, peripheral vascular disease, cerebral vascular disease, strokes. All of the it puts a tremendous strain on your blood vessels and causes atherosclerosis or plaque buildup in your arteries. But there are things that raise the blood pressure that so many people don't know about. There's a few key things.
Okay, let's hear them.
Yeah, let's hear this. Let's go.
Well, number one is coffee.
Oh, really?
See, what coffee does,
Mean.
see, let me explain how blood pressure works. It's real simple. It's just think of your faucet, or think of your faucet outside with your hose attached. Now, when you turn up the volume of that water, it increases the pressure in that hose. When you take coffee or anything that constricts your arteries, like it could be, anything with caffeine, excessive tea or energy drinks, caffeine constricts those arteries. It increases vasovagal tone. And so it increases these, sympathetic neurons or nerves, and also it increases adrenaline and noradrenaline that constrict the arteries, and it's like constricting the hose, driving the pressure up. So over 2 cups of coffee will increase your blood pressure. Coffee can increase your blood pressure, raises it 3 to 14 millimeters of mercury. A cup of coffee.
Well, what's that mean?
That means it can increase your blood pressure into the high blood pressure range. So if your blood pressure was normal 120 over 80 and your pressure went up anywhere from 3 to 14 points, it could push you into high blood pressure, but it lasts for 3 hours. So
Well, you're not
Is that
saying
really? Go ahead, Mom.
well, you're not saying that like 1 cup of coffee a day is harmful or anything, because you
Well,
actually include
yes,
1 cup.
1 cup of coffee is usually okay,
Okay.
but most people have their cup is 16 to 24 ounces.
Okay.
If it's 8 ounces, but I'm just saying too much coffee, too much caffeine can raise your blood pressure
That's
temporarily for
right.
a few hours.
Okay.
And that's why when people come to my office, they've usually had 1 or 2 cups of coffee, many 2 or 3, and their pressure's high. So I have to have them wait till afterwards so I can get an accurate blood pressure reading. But some people have to have coffee every 3 hours the entire day,
Mm,
and they're jacking their pressure up.
that's going to keep it up. And that damages your kidneys.
High blood pressure damages the kidneys. That's one thing it does. It causes plaque buildup in the arteries that supply the kidneys, and high blood pressure like pounding your kidneys. So eventually your kidneys start to become damaged and don't filter properly. The two most common triggers of kidney disease are diabetes and high blood pressure, over and over. But that's one thing that raises your pressure. The other thing that raises your pressure is stress. Stress will raise your pressure. Why? The same mechanism. It causes that norepinephrine, epinephrine, those sympathetic nerves to be stimulated that constricts the arteries and drives the pressure up. That's why slow, deep breathing resets the autonomic nervous system, relaxing, casting all of our cares on the Lord because He cares for us. Learning how to cast your cares on the Lord is critical, because if not, literally, we carry the burdens of others and it constricts our arteries.
Laughter.
Laughter is one of the best medicines. I would say it's the best medicine to lower your blood pressure.
Find a way to laugh.
But
God
other
laugh.
things is weight gain. For every 20 pounds of weight gain, it drives your pressure up 5 to 20
Now,
points.
Don, this applies to everybody. No matter, I don't care what their age are. I mean, you can be in your 80s and this is true, right?
Absolutely true.
Okay.
But for every 20 pounds of weight you lose, your blood pressure drops between 5 and 20 points. Isn't that amazing? So weight gain is associated with high blood pressure. And realize so many people are obese now. We have like almost 43% of adult population is obese. And so for all that excess weight you're carrying, it causes more constriction of those blood vessels. It's like having too much, and you absorb too much salt. Salt raises your blood pressure. A lot of people crave salt, and the average person takes in like 3,400 milligrams of salt a day. And again, that's way too much salt. To lower your blood pressure, you decrease your sodium intake to around 1,500 milligrams a day. And that literally helps to lower the blood pressure. The more salt you take in, the higher your pressure goes. It's that simple. Now, let me tell you what's real high in salt: processed foods. A lot of the foods in restaurants, they heavily salt them. Most packaged foods, like your instant rice, loaded with salt. Instant potatoes, loaded with salt. But these also spike your blood sugar, and they increase your insulin levels. They cause more weight gain. And bacon and sausage and processed meats and all these deli meats are so full of salt.
Deli meats, they're so
Oh,
full of salt.
As well,
I had a buddy who was a guy in a manufacturing plant, and he says those things, they inject so much salt in because they preserve them.
exactly.
That makes so much sense.
And also all these sauces we eat, like soy sauce and teriyaki sauce, and all these sauces are so full of salt. But salt raises the blood pressure.
You know what's a caveat with this is the fact that so many people are adrenal fatigued.
Oh
And
my.
they are
Yes,
so
they
exhausted.
crave
Number
salt.
one thing we hear, people are exhausted, they're tired, and that makes you
Yes.
naturally crave
Yes.
salt.
Absolutely.
So it becomes this catch-22 where
Or coffee.
your coffee.
And your
But Mary, it's just
Exactly.
yeah,
It's your
exactly.
energy and all of that.
But
stuff.
another thing that so many people are missing, most doctors miss this, and I see this almost every day in my practice: sleep apnea. The fatter people get, the more the soft palate sags. The more it sags, it blocks the breathing at night. They lay on their back, there's like a curtain dropping down, their soft palate sagging, and they're gasping for air, and their blood pressure's going up. A lot of these people with sleep apnea, it causes their pressure to go up. Now, here's how it works. When you're not getting enough oxygen to your brain, your arteries constrict. Your arteries constrict to get more blood flow to the brain. But when you constrict these arteries, it causes your blood pressure to go up. So many people with sleep apnea have hypertension that's unrecognized. They carry this on for years. It damages the brain. The brain actually is starving for oxygen. So the memory, short-term memory goes.
Yeah.
And then so we pick it up commonly in these people with big necks. If a man has a neck of 17 inches or greater, usually they have sleep apnea. Women, if it's over 15 inches or greater, sleep apnea. It is epidemic. I see it almost every day in my practice. And yet so many people are unaware of it, but that's a major cause of high blood pressure.
Okay, on doing the blood pressure, because we talked about this
Yeah.
earlier,
You-
you can get your own blood pressure cuff at CVS Pharmacy, Walgreens, the little bitty, they cost like $59. They're not expensive. You put it around your wrist right here, and how you take your blood pressure is very, very important.
Very important.
First, you need to be sitting for at least 5 minutes before you take your blood pressure, a minimum of 5 minutes. Then you take and put that on you, and then as it pumps up, then you put your arm up near your heart like this. If you have your arm down, like sometimes you go to the doctor's office and the medical assistant comes and takes your blood pressure, if your arm is hanging down, it's going to give you an inaccurate blood pressure reading. Your arm needs to be up, level with your heart, Or
Don't cross your legs.
and don't cross your legs.
Like there's
But I'm not taking blood pressure right now. I'm just demonstrating. So you put that around your thing and then you put it up near your heart. That's the proper way to get an accurate blood pressure.
And don't talk. You're not
And you
supposed to.
can't talk, which is the hardest
Absolutely.
part.
That's the hardest part from here.
Is when they're doing this. So remember those little points. So if a nurse is doing it, you need to remember that and correct them and say, no, 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 you're not doing my blood pressure right. And then you like them to do them on each arm.
Both arms, yeah.
To do it on both arms. To
Now,
balance.
What's the reason for that?
Well, because it's different.
You
in
get
both
different
arms. Yeah,
readings?
you can get different readings
Wow.
commonly. And plus, so many of my patients come in, they've had coffee, then I have to check it again at the end of the appointment. And at the end of the appointment, it drops down to normal, so I don't worry so much. But I say, oh, how many cups of coffee? Yeah. Oh, 1 cup. How big was your cup? Well, it's about 30 ounces. So I check it at the end after they've been there for 2 or 3 hours and their pressure
Yeah,
usually
because your
normal.
appointments with Dr. Colbert are not 5 minutes.
That's right.
Yeah, for most people, they'd go, wait, how do you check it at the end? Because my appointments with the typical doctor is like 5 minutes.
Yeah, 5 to 10 minutes. But now, how do you lower blood pressure? The key thing is reducing your salt, increasing your water intake, clean water, and we're going to talk about water later, but also following either the Beyond Keto diet right here or the healthy Mediterranean diet. This is the healthy Keto Zone diet, where you don't eat all the bad fats, no butter, cheese, cream, but healthy fats. Extra virgin olive oil, avocados, fish, a lot of good fatty fish and fish oils, and also low carbs. Low carbs is the key. Lots of veggies, lots of salads, and lots of extra virgin olive oil, high phenolic,
Living food.
but also exercise.
To avoid confusion,
Yeah.
everybody knows about the Keto Zone diet, and this
Yeah.
is just the modified
Yeah,
Keto Zone diet.
it's
So
the
after
updated
Keto Zone, Keto Zone diet is very relevant, but you want to make some updates based on some new information.
Exactly.
And what was some of the new information for the Beyond Keto versus
Well,
Keto
the
Zone
biggest
diet?
thing is more fiber, fiber, fiber. The average American only consumes about 10 to 15 grams of fiber a day. So we need fiber. The average male needs about 38 grams of fiber. Females need 25 grams of fiber. We are not getting enough fiber. As a result, we're seeing tremendous amounts of colon cancer in this country at younger ages. So I put the fiber back, the vegetables back, the salads back, the extra virgin olive oil that's high phenolic. I made so many important adjustments, and I cut way back and eliminated, for most part, most of the bad cheeses. Now, again, they can have some feta is okay, because, you know, the most common allergies we see over and over in my office?
Dairy.
Dairy, wheat, soy, eggs, tree nuts, peanuts, shellfish, fish. Those are over and over, and people are eating their kryptonite. And so I tell them, quit eating your kryptonite. Let's eat living food so you can have a living body that is disease resistant.
Do you know we have 12 numbers you
That's
need to
just
know?
one. Oh, no.
12
For
fingers.
the next 11.
That is critical for you to know. And we just barely got through
Oh,
one.
my.
We're trying to condense. We have a lot of information, but I'm going to just encourage you.
But it's good.
Don't go anywhere. You want to get all 12 of these numbers.
Yes,
You can
amen.
live long and strong. Go ahead,
Amen.
take us out,
Amen.
Kyle.
Okay. Stay with us. We'll be right back. Let's live long and strong. We want to learn these next 11 numbers.
Please help us spread the word.
Yes, amen.
You can reach people we can't reach. And by you hitting the like button and sharing this video, you become an evangelist of health. So help us do that.
Okay, now you've been listening to Dr. Colbert's broadcast. Again, like my mom said, if you like the video, like, share, follow us on YouTube. If you need to get the Fiber Zone, you can go to divinehealth.com along with Beyond Keto. We'll see you in the next show.